Hi, Dr. Sasse here from the Continence Center. I served a bunch of years in the Air Force Reserves, was never deployed, but I got to interact with a lot of great people. And lately, a bunch of my buddies who've had their care at the VA system have asked me, how come they have bladder leakage and loss of bladder control after prostate treatments? So some of these buddies of mine have gotten a little older, and some of them have faced treatment for prostate cancer, which can be either surgery or it can be radiation. And in both cases, a significant fraction of men will develop bladder leakage. If we're lucky, the bladder leakage will be temporary, and over the course of months, it gradually improves and it may get to the point where it's pretty livable. But for a significant fraction of people, the bladder leakage or the loss of bladder control can be pretty severe and it can be permanent. And so I'm just going to get to how we can treat it and how we can try to make that better. How does it happen? Well, one way it happens with surgery is that there can be damage when the prostate is removed to the very fine tissues around the urethra, and that can be the sphincter muscles themselves. Perhaps more importantly is damage to the nerve signaling that goes to the sphincter muscles and to the whole pelvic floor to allow us to have a good control of emptying and then stopping the emptying of the bladder. So what can be done? Well, one can do the kinds of things we all do to try to minimize having bladder, need to empty the bladder at night, like avoiding drinking a lot of fluids at night. You can practice some behavioral changes like emptying the bladder and then trying to re-empty it again, so-called double voiding. There are some medications which, if you've heard me talk on other posts, are not so effective, and they have a lot of side effects, particularly cognitive side effects for us if you're over 50, and are not recommended. Surgery itself is more invasive. There's things that generally are mediocre in our view, such as artificial sphincter and sling-type interventionist procedures. But what has emerged on the scene over the last years, in which we've had great effect with a lot of people in the shoes of my friends in the veterans type world and people who've had prostate radiation or surgery, is sacral nerve modulation. This is a much less invasive intervention with a tiny local procedure done under local anesthetic that restores the neuromuscular transmission lines to the pelvic floor muscles and to the bladder sphincters. So in placing this tiny little gizmo, it's kind of like a cardiac pacemaker. It restores the transmission lines to the muscles, and all of a sudden you have good restoration of the tone and also the coordination of the bladder sphincters and the urethral sphincters. Most people see a dramatic improvement, far less leakage, far less accidents, and a whole new improvement and lease on life. Please know that there is good hope out there. There is a good solution for this, and it usually has a very high effectiveness rate with very little side effect downside, practically none. Worst case scenario, you don't like it, take it out or just turn it off. It's not going to cause any new harm. Way less invasive than some sort of surgical intervention. Of course, we always pair that with doing some exercises, sometimes pelvic floor training, doing squeezing exercises, positional exercises can help solidify those gains that come from sacral nerve modulation. I hope you found that helpful, and I hope that you have great health, and I hope this has totally helped solve you or someone in your life solve that bladder leakage problem.